and I'm involved in media, I need internet. And I use internet all the time in my business, which is video production and media. My house is hardwired and safe. My children are safe in my home. For a long time, physicians were the authority in health. Patients trusted their doctors' education and expertise. For the most part, followed their advice. When health concerns about cigarettes began to receive public attention in the 1930s, tobacco companies took preemptive action. They capitalized on the public's trust of physicians in order to quell concerns about the dangers of smoking. Thus was born the use of physicians in advertisements. The public was becoming increasingly worried about the health consequences of cigarettes. They started to refer to cigarettes as coffin nails and started talking about smokers' cough and smokers' cough. The company saw a threat to the success and business model. Executives at tobacco companies knew they had to take action to suppress the public's fears about tobacco. Tobacco companies asked themselves, how can we go about reassuring the public that particularly cigarettes, but also cigars and pipes, are not harmful? Jackler told Hem Onk today, quote, the answer was use medical research and physicians to show the public that cigarettes were not harmful. Although the doctors in these advertisements were always actors and not real physicians, the image of the physician permeated cigarette ads for the next 2.5 decades. Physicians were also not immune to the addictions of cigarettes and tobacco products, and tobacco companies knew it. Many physicians still doubted that there was a widespread connection between smoking and disease. Instead, it was believed that only certain individuals' health was affected by smoking. It was thought to be a case-by-case situation. There were big ad campaigns with hundreds of ads in medical journals. For example, there was an ad showing a physician writing out a prescription pad for your patients with sore throats and coughs. Philip Morris cigarettes. The pages of the New England Journal of Medicine and the Journal of the American Medical Association were home to many tobacco advertisements throughout the 1930s and the 1940s and beyond. However, tobacco companies' coaching of physicians did not end with medical journal. The present situation with Wi-Fi has a lot of similarities. Except today, if someone is affected health-wise by Wi-Fi, we say that they are in the minority, and they are very sensitive to it. A small percentage, we say, that are suffering from electrohypersensitivity. What if the people who are sensitive to Wi-Fi are like those that first got sick with tobacco smoke, and they are simply the canaries in the coal mine, warning to us all of the catastrophe if we don't take the threat of microwave radiation seriously?
Thank you, Chris.